One of the most special memories I have of doing research with children in neonatal intensive care was looking at a baby who was in an incubator, and her mum was next to me and I was touching the baby's foot. And every time I touched the foot, we could see a little pattern of activity in the brain. And the mum said to me, "Can I touch the foot?" She was quite anxious about the fact that she couldn't hold her baby in the way she was expected to. Yet every time she touched the foot, she could see that she was having some impact on her child. A child who's born who requires intensive care, on average, will have about 10 painful procedures a day. And given that their hospital stay is often 50 days or more, this is a huge burden in early life. It's quite incredible, but it used to be thought that babies just don't feel pain. And the idea was that although you could see that they were responding and moving, that this was merely reflexive and not to then be processed by the brain. Oxford has been a really important place for work on pain in children. And back in 1987, a really important piece of work was done where children were randomised to be given pain relief during surgery, and in the other group, standard practice was used where they were mainly given muscle relaxants. The children who were given the pain relief had better outcome measures after the surgery. And this really changed clinical practice because it was not considered acceptable not to give them appropriate pain relief during surgery. And now the Department of Paediatrics has made it a priority to look at neuroscience during development.
The only tools that exist at the moment look at facial expression, and obviously, I mean, anyone who's got a child can see that they pull very much the same facial expressions for pain, for I'm hungry, for I'm wet, for all the things that they do.
And one of the options that we have is to look at what's happening in their brain. We used a number of techniques. One is called EEG, where you can put some electrodes over the surface of the baby's head and see whether there are any particular patterns of activity that only occur when you do something painful. We've also started to use an MRI scanner, and you can look at the whole network of activity following pain. fMRI has been used to understand pain in many, many different studies, but it's never been used in babies.
What they used on Amy today was one of these punctate stimuli, they've told me, and as you can see, it really doesn't hurt. It looks like a little pin, but it just bounces back inside the tube.
I want to know that I'm able to give the appropriate drug and know what effect that drug is having on the baby. And the number of clinical trials that have been done in the neonatal population is very small, and are mostly based on facial expression. So until now, there was no way of knowing exactly what was going on in the nervous system and whether we're having an appropriate effect. So it's very important to treat pain in this population because they're a vulnerable population, which we want to have as little impact on as possible so that they develop as normally as possible.
Yeah, not many people get a chance to look inside their baby's head that early on, so I'm really pleased that we got the opportunity.